Hello, I'm Dr. Tejaswi Shashikanth, a consultant urologist from Naruvi Hospitals, Vellore. First of all, I hope this video finds you and your family safe and well. Today, I want to briefly introduce to you the concept of men's health. Throughout the world, the average lifespan of a human being has been increasing. Childhood vaccinations, endorsing a healthier lifestyle in terms of diet and exercise, and smoking cessation have made a true impact in extending the human lifespan. But there is one particular statistic which seems highly peculiar, and that is, on average, men throughout the world tend to live shorter lives when compared to women. And this not only applies to the most well-developed countries in the world, but it also is seen even in the least developed countries in the world. To take an example, in America, the average lifespan is 79.3 years, but on closer look, it becomes obvious that women who have an average lifespan of 81.6 years live an almost 5-year longer life compared to an average male who has a life expectancy of 76.9 years. Even in sub-Saharan Africa, which is generally the place with the least life expectancy around the world, men have an average 5.3 years lesser life expectancy when compared to women. Even in India, an average woman is expected to live for 69 years, whereas an average man lives only for 66 years, another significant 3-year difference. In fact, there is not one part in the entire world where men tend to outlive women. If you're thinking that this average life expectancy is the only thing less in men, it is also seen that men not only live shorter lives when compared to women, but also lead a sicker life as well. Studies have shown that men fall ill younger and they are more prone to major chronic diseases like cancer, hypertension, and cardiovascular diseases. So why is this happening? Why is it that men have all these bad problems? A lot of reasons have been given to explain this. It has been said that there is an increased exposure to physical and environmental harm compared to women. There is also a propensity on the men for high risk taking behaviors, including alcohol usage, smoking, high risk sexual practices, etc. Research also indicated that men and boys experience relatively more social pressure to endorse gender stereotypes. Now, what does that mean? It basically means that from a very young age, men and boys are told that men are independent, self-reliant, strong, tough, etc. So what it ends up doing is this leads to men tending to boast about never having to visit a physician in their lives. They refuse to take off time from work when they are ill, and they are also less likely to be compliant with even prescribed medications. So, even though men and women have differing healthcare needs and concerns, there is a particular branch of medicine called gynecology which is dedicated exclusively for the health of women. Men's health has remained devoid of a holistic approach. So this is where a urologist can come into place. This is because quite a few men, once they enter their 50s and 60s, tend to re-enter the healthcare systems by the way of a urologist's office because they end up complaining of lower urinary tract symptoms due to benign prostatic enlargement or erectile dysfunction. It is often said that a man's sexual health is a barometer of his overall fitness. This is because there are quite a few risk factors which tend to overlap between cardiovascular diseases and erectile dysfunction. For example, obesity, diabetes, and smoking are both very common in people who tend to have cardiovascular diseases and those who present with erectile dysfunction. High-quality research has shown that erectile dysfunction may be a single warning sign of an elevated risk of sudden cardiovascular disease events. Also, the severity and duration of erectile dysfunction has been correlated with the magnitude of coronary artery disease. So, A dedicated men's health curriculum is long overdue. I think we should all agree with that. But men's health should not only be limited to conditions which are solely focusing on urologic or cardiovascular conditions. There are quite a few common issues which tend to be frequently overlooked. For example, mental health, depression, suicidal tendencies are much more common in men compared to women, and they tend to be hidden from the normal perspective. Also, gastrointestinal, rheumatological, and renal diseases also tend to get overlooked. According to a latest study published by Miner et al. In 2018, men's health ideally should be categorized into four groups. The first group include conditions that are completely unique to men. This includes prostatic diseases and erectile dysfunction. The second group include conditions that are more prevalent in men compared to women. This include cardiovascular diseases, stroke, and renal diseases. Then the third category that includes health issues for which risk factors and adverse outcomes are different in men. For example, in obesity. And finally, the fourth one, issues for which interventions to improve health and well-being are required for men. For example, improving access to delivery of healthcare systems. So an ideal men's health curriculum must understand the impact of masculinity factors on healthcare engagement and outcomes. Factors like psychological stressors, including employment, culture, geographic location, will need to be addressed. Men's health is a very emerging branch of science, and a lot of research has been dedicated for this area. Let's hope in the future that health of a man is given as equal importance as that of a woman. Thank you very much.